Welcome everybody to Pre-Health Shadowing's virtual shadowing session. I am very honored to host you guys. As we are living through this global pandemic, I recognize how difficult it is for everybody to gain the insight that they need for their potential fields in health. And now more than ever, it is so important to develop the next generation of healthcare professionals as we continuously live through this global pandemic. So welcome all, and let's get started. Pre-health shadowing is able to connect students from not only all over the US, but all over the world. So go ahead and drop in the chat where you guys are Zooming from today. Welcome everybody, it's a pleasure to have you. So a couple things before we begin. We do send out emails once a week at the beginning of the week with all of the speakers for that week. So if you guys are interested in finding the registration link, the Zoom link, and you want it all at the beginning of the week to plan it out, definitely sign up for our email list. This is on our website, prehealthshadowing.com/join us. And then once you do that, you're going to want to ensure that you're actually getting our emails. And so you're going to want to check your junk, you're going to want to check your spam, check your promotions folder, whatever it takes. Once you find them, you can mark our emails as important and also save Pre-Health Shadowing as a contact. And this will ensure that all of our emails go directly to your inbox where you can see them on time and not 4 months later. And you're like, dang it, I missed it. We have closed captionings for all of our live sessions to accommodate students with hearing disabilities. So part of pre-health shadowing is creating flexible and accessible opportunities for students around the world. And so we want to ensure that we are giving the tools that everybody can succeed. If you are looking to give back during this crisis that we were in, we have partnered with Mask for Mask. So every 4 masks that are purchased, 4 masks will get donated to someone in need. This can be a hospital with a lack of resources, or a homeless community, or anybody who does not have the means to get the proper protective equipment. So you guys can actually get 15% off. They have a bunch of different designs. Go ahead and show your support, get a present for someone. It's not something that is gonna just, we're not gonna need, like, we're probably gonna have these for a little while. So 10% of all proceeds go towards pre-health shadowing, which is completely free for all students, so that you guys can get what you need for the rest of your life. Visit their website, maskformask.com. Alrighty. Whoa. All right, another announcement is we have partnered with Fem Health, where they are hosting a purpose summit. So this is an amazing opportunity for anyone who is interested in leadership within healthcare. They have 19 powerful founders, CEOs, leaders in healthcare, all women who have succeeded in their roles and are looking to provide their insight to the next generation. So if you guys are interested, we will be having free opportunities. You guys can actually purchase a ticket. This is a year's worth of content and material and connections and networking opportunities for $30. So it's $29, and every time you sign up with our specific link that we will provide to you next week, you guys will get to give back to pre-health shadowing. So we will get 50% of all of the proceeds. We will give more information about this in our future sessions. If you are interested in getting published, pre-health shadowing is now taking submissions. You can submit an article, a reflection, a review, and a success story. This is really great for any applications, CVs, resumes. You can put it on your LinkedIn, be like, look, mom, what I did. And yeah, so if you're interested, you can only sign up by using the URL in this PowerPoint. You cannot access this from the main website. All right, so if you are interested, be sure to write it down or take a picture really quickly, because once it's gone, it's gone. All righty. Pre-health shadowing is creating a podcast. And so we have a student team that will be running this. If you guys are interested in getting involved, you can actually apply to join the student podcast team. So we will go ahead and have someone put the link in the chat if you are interested. I invite you all to pull out your phone. This will take you to this QR code, which will then bring you back to a page on our website. This page is the donate page. And so we are a student-based, student-led nonprofit organization focused on creating flexible and accessible opportunities for students. Please help us keep this free. If you are financially able at this time, please consider donating at least $1 to help benefit our programs so that we can keep our website up and running. Right now, we are maxed out at 300 students. So today we have over 500 students registered for the session, but only 300 will get to join us because we do not have the funds to upgrade our Zoom platform or website to accommodate the large load of students. Thank you. If you are a high schooler and you are interested in getting involved in joining the pre-health shadowing team, we do have a high school training for pre-health shadowing program where you can connect with like-minded high schoolers around the US. This is an opportunity to establish pre-health shadowing as a club on various campuses. So if you guys are interested in gaining this student ambassador role, feel free to apply on our website, prehealthshadowing.com/join our team, and then just indicate you are interested in joining HTP. Alrighty, if you are looking for a mentor, and this is something that we might talk about today, we are hosting a mentorship networking weekend. So this will give you the opportunity to meet with up to 6 professionals that are established in their various fields and specialties, as well as connecting with other like-minded students. And you can potentially get a virtual mentor for life. So this is by invite only. So if you're interested, listen up to see how to get your invitation. All you're going to have to do is go to our Google Drive and download our 3 pictures. Once you do that, you can post those 3 pictures. You can add a little personal touch, may it be a video or another post that explains your personal connection. Register as a volunteer, posting it on your social media. And once you're all done, you're going to submit your filled up board to receive an RSVP link. And it's that easy. So if you guys are interested in gaining a mentor that you could potentially have guide you for the rest of your life and your career, check this out. If you are interested in becoming a volunteer with pre-health shadowing, we are allowing students from all over the world to join us as we continue developing our program to have a greater impact on the world. Prehealthshadowing.com. Check out under the contact tab, you can see volunteer. If you're joining us for our live session today, go ahead and post on your social media for a chance to get reposted and featured on the official pre-health shadowing account. Go ahead and show us your setup for today. So how are you taking notes for pre-health shadowing? Don't forget to tag us. Throughout the entire session today with pre-health shadowing, you can receive a certificate at the end of the session after taking and passing the post-shadowing assessment with a 70% or higher. So I recommend you take good notes and ask our professionals some wonderful questions. Feel free to drop questions and comments in the chat throughout the session, and we will be sure to ask them during the Q&A portion. Without further ado, I would like to welcome to you our professional for today. Hello, Dr. Alvarez.
Hi there.
It's wonderful to have you. Thank you for joining us.
Yeah, I'm so excited to be here. I'm actually very nervous to see so many people. I did not expect this big of a group, so it's really great.
Awesome. Whenever you're ready, go ahead. I'm going to release a poll for our students. This is going to allow everybody kind of just take a look around the room, see who is joining us today.
Are you guys waiting for me, by the way, or are we waiting for the poll to show up?
Yeah, we're waiting for the poll. Feel free to share your screen if you're ready. We do have 80% of our students who voted. I'm going to wait for a couple more. If you have not yet submitted, go ahead and do so. Wrap it up, and we will go ahead and share it. All right, I'm going to close it. You have 5 more seconds. All righty. So I'm going to share the results. Have a lot of bio majors, so welcome everybody. Everybody's interested, not everybody. Most people are interested in medicine today. Got a lot of second, third year college students.
Cool.
Oh, interested in gaining a virtual mentor. So we are having our mentorship program. Like I had mentioned, our mentorship networking event is on February 19 to 21. So be sure to check out our website. We had one of our team members put it in the chat. I recommend if you are on a computer to just open it and leave it in one of the tabs for you can revisit it a little bit later. Feel free also, if you are looking to get involved, we are taking volunteers and it's super flexible. I'll talk about it again at the end. But yeah, super flexible volunteering opportunities. You can get hands-on volunteering opportunities if you'd like as well. And if you are looking for a leadership position, you can apply to join our team. So definitely stick around and I will go in depth at the end of today's session. All right, thank you, Dr. Alvarez. The floor is yours.
Alrighty, thanks again for this invitation. When I got invited, I initially envisioned like a small group of people that I'll be sharing some stories, and now apparently this is recorded and it'll be in YouTube. So if there's anything here that's not supposed to be here, just give me some grace. But otherwise, hopefully we can have some Q&A at the end as well. So today, so by way of introduction, my name is Alvarez. I'm one of the assistant program directors at Stanford Emergency Medicine. And I been working at Stanford for the past, really affiliated for the past 10 years and full-time for my role about 4 years. Before I continue and get carried away, let's just take care of some disclosures. I really don't have any, maybe someday. And so 40 years ago, 2 Hungarian educators, Laszlo and Clara Polgar, decided to challenge the popular assumption that women don't succeed in areas requiring spatial thinking, such as chess. They wanted to make a point about the power of education. So the Polgars homeschooled their 3 daughters. And as part of that education, the girls started playing chess with their parents at a very young age. Their systematic training and daily practice paid off. By 2000, all 3 daughters have been ranked in the top 10 female players in the world. The youngest, Judith, had become a grandmaster at the age of 15, breaking the previous record for the youngest person to earn that title, held by Bobby Fischer, by a month. So today, Judy is one of the world's top players and has defeated almost all the best male players. And this is from an article from the Harvard Business Review that I wanted to share because before I continue, spoiler alert, I am not a grandmaster chess player. I don't even play chess. However, I think it sets the tone of what we're going to be talking about today. This is me with my mom. I grew up in the Philippines and my mom works as a nurse. And growing up, my brothers and I were separated from her so she could work in the US and pay for our education back in the Philippines. And I moved to the US when I was 13. I'm a first-generation physician. My mom raised me and my brothers as a single mom. Since the title of my talk uses the word vulnerability, I'll be sharing some things here with you today in my hopes to give you a perspective of what one's journey can be pursuing a career in medicine. My parents divorced when I was young, and my dad does not have a college degree. My grandfather drove this jeepney car, which is an equivalent to like a bus here in the US. I remember when I first got to the US, my guidance counselor told me that I don't have to worry about the SATs, just pass the TOEFL test. She gave me some brochures about community colleges and BOSI programs, and I don't even know what those are, but everything was foreign. But somehow I passed my SAT, I got into the University of Buffalo, And I don't know about you, but my goal for college was to, number one, see snow, because again, growing up in the Philippines, we didn't really have that. And number two, be far enough from my mom, but not too far. I told you that we didn't grow up with our mom, and so imagine all of a sudden raising three grown kids, and that's a lot for her and also a lot for us to kind of get used to. So I wanted to be out of that house, and looking back, I'm really grateful for the struggles and sacrifices that my mom went through, especially putting up with her kids, myself included. I think especially me. So yeah, I went to the University of Buffalo. It's a state school in New York. I've had a lot of fun memories there. I even joined the ski club, which was weird because never really learned how to ski before, and I still don't ski. I ended up picking up snowboarding, which is really a story for another day. And by the way, I've given a similar talk like this to University of Buffalo back in 2018. And I can tell you that I didn't share as much vulnerability then. Today, when Nina mentioned that, oh yeah, this is going to be recorded, I was like, oh crap. And so I got nervous, and I still am. Actually, you can tell if you know me that I'm a bit nervous right now, which is weird because as an emergency physician, managing stress is part of my job. And so here's a trick that I use that applies to any situation that gets your heart racing. And so managing that, which is what I've been doing in the past couple of minutes since starting this talk. That's pictures of snow, and then I'll go back to that in a bit. But really, talking about stress, you see, in my line of work, I deal with all sorts of emergencies. When I'm in a resuscitation, I still occasionally get nervous. I've cracked chests open, put tubes in people's bodies, pulled stuff out of people's bodies, and all the blood and the gore they can think of. And when we do these, we're supposed to be calm and collected. And we're supposed to ignore the surge of adrenaline. The reality is that our body betrays us. Imagine putting in an IV in an agitated trauma patient or a COVID patient gasping for air on a ventilator. And this phenomenon is very common. We call it needle epilepsy, or you're having a needle seizure. And so for those non-medical people yet in the audience, and I should say not medical yet really, because again, I believe in growth mindsets. Someday you will get there. And I know that you'll go through this. You don't have to be in the emergency department to see that your hands will shake when you're nervous. I still do. In fact, if you're able to see my hands right now, you'll see it shake a little bit still as I'm warming up to give this talk. And so, do you know what we normally tell that person when they're shaking and they're about to do something critical? Stop shaking, right? And what do you think happens? That's right. They shake even more. And so it's not helpful. You're not being helpful in a high stakes, high risk environment like resuscitating that COVID-19 patient. You're more likely to make a mistake. In fact, this hand tremor has also been seen after high stress events like being involved in a car accident. They've looked at people's handwritings in police reports and realized a big difference compared to their baseline handwriting. So then how can you effectively calm yourself? Let me introduce you to a practical tip several of us use in the emergency department. It's the concept of box breathing. Here's how it works. You inhale over 4 seconds, and then you hold your breath for 4 seconds. And then you exhale over 4 seconds. And this is the toughest part. You hold your breath again over 4 seconds. Again, it's fairly simple. It doesn't take a lot of time, and it's clearly free. And you can do this multiple cycles. And try it next time when you're getting hyperactivated during either a resuscitation or getting revved up when you're about to go into an interview and you're about to go to take a test. Because otherwise, your reaction will be to, well, if you're in an argument, you're going to raise your voice, you're going to get angry and say something that you'll regret later. Now, I'm not a ball sports person, but if you watch a game of basketball, you'll see them run from one side of the court or to the other. Then right before they shoot that ball, what do you see them do? That's right. They pause. And what you don't realize is they're actually taking a deep breath as well. Without doing so, their heart rate is going so fast. Think of when you're in a treadmill. The faster you go, the higher your heart rate becomes. And at a certain point, you start having tunnel vision. But maybe that's just me. But next time you sense that you're having this tunnel vision, slow down your breathing. This sends a signal to then slow down your heart rate. So yeah, ball sports. Just before shooting the ball sports person starts to slow down their breathing, which effectively slows down their heart rate, allowing them to focus better. Sometimes they shake their shoulders and then they inhale and then shoot the ball. The Navy SEALs use a similar technique. Some call it tactical breathing. Imagine running with all the heavy equipment that they're carrying. And then as the sniper trying to catch their breath, what you have to do next is then to precisely shoot at that target. And so you need that breathing technique. Okay, so where were we? By the way, emergency medicine, we're easily distracted. We're drawn to intense environments. And so bear with me if I jump from one topic to another. Welcome to my brain. And so here, where were we? So we were in Buffalo. I went there for undergrad. Libby Morsheimer, that a woman on the upper left, she was my pre-health advisor. She can tell you that I was all over the place. And thanks to her, I had a semblance of direction. In fact, I remember passing by her office every semester to get approval to take more than 24 credits a semester. In retrospect, I think I wanted to pursue so many things. And I also knew that by taking more classes, I actually could get more financial aid. And so I took summer classes, for instance, because it meant that I could stay in Buffalo and not be able going back home, right? So that I can actually pay for my dorm. Otherwise, I would go home in Long Island, but it meant living with my brothers and my mom and finding a job. And well, for me, well, that sounds fantastic now. The rebellious teenager in me then really did not want to do that. I turned 17 when I started college. And so I was really on the younger side of the spectrum in my class. Anyway, I knew I wanted to be a doctor. I thought that I had to be a bio major. I saw there are several bio majors in the audience. And then I realized that the department is so big. And so I switched majors at least 10 times, just my first year. I kid you not. I applied to the University of Buffalo initially for their occupational therapy because my mom told me they make good money. She actually discouraged me from becoming a doctor. She said it was too expensive. And so I was a math major, a mechanical engineering major. And then I switched back to biology. I even tried to create my own major during freshman year. Biomedical engineering, which actually exists now there. Before it was something like only a few programs in the country had. And then I realized that I couldn't draw for the love of me, which is what you need as part of your engineering degree. And so I switched to biophysics. And don't worry, I really have a point here. My point is that I had no direction, but I followed my passion, no matter how fleeting those were. A quick segue, during my second year, I applied to, the University of Buffalo had this early assurance program. It's like getting into medical school your second year of undergrad. I was so unprepared. For me, if I could give you an advice, or if I can give myself an advice now to the person that I was then, it would be just that, hey, I was unprepared. And it didn't really help that my hair was blue. And when the interviewer asked me what specialty I'm interested in, I quickly responded ER because I love that TV show. And she made a point to tell me that I probably should be making life decisions based on a TV show. And she's right. I needed experience. What I lacked in medical experience, I made up for it elsewhere. And so, well, my mom helped some of my education. I tried to really be self-sufficient. I had 3 jobs while I was in college. I worked at the copy center, which is like the FedEx office nowadays. I also worked for a biology lab, and I also served as a resident advisor in the dorms. These were actually fairly strategic. The copy center, fondly called making copies, gave me some benefits like being able to photocopy my text that I couldn't really afford. The lab gave me some research experience. And being an RA also meant that my room and board was also covered those years in college. And so by third year, I sat with Libby, my pre-health advisor, because I needed to figure out what I needed to do in order to graduate. I still remember that meeting. It was like she was doing this jigsaw puzzle with me. If I take 2 more classes, I'd finish a degree in biophysics. If I take 2 more classes, I can get a minor in chemistry. If I take 1 more English classes, and so on. And here's another segue. By now, you'll notice this pattern in my journey. It's all over the place. And somewhere along the way, there are key people that helped me. Working at making copies, I met Dr. Nancy Nielsen, who at that time was I believe she was the AMA president. She needed some business cards done. I can't remember how many people I've met at making copies asking for business cards done, but I remember being interested on what they do. And so I need like why they would need the business cards. And so when I found out that she was the dean of the medical school, I invited her to speak at the induction ceremony for the Alpha Epsilon Delta, the Pre-Med Honor Society. It was then that she heard me speak to the group about turning lemons to lemonade and how each of us have our own struggles in life. Unbeknownst to me, that night apparently triggered a conversation between Dr. Nielsen and Dr. Porosky, the dean of admissions at UB, and I got waitlisted at UB Medical School. I didn't get into any other medical school, actually. I barely broke a 30 on my MCAT, which now I think would be like way less than average. I know the scoring system is like 500s. So once again, I met with Libby to strategize on my life. We looked into gap year into anticipation for planning to reapply for medical school the year after. There's no question that I wanted to do medicine. It was only a matter of when. And so I remember getting an email from the university honors program about a summer job called CTY, or Center for Talented Youth, through Johns Hopkins University. It's an RA job, resident advisor job, which I've done for the past couple of years. And it's a job across the country. And so I applied to the program at Stanford because, well, I wanted to check out California. I've never been. And so Libby helped me with that application, and also helped me find out about this program called AmeriCorps, which is like the Peace Corps, but only in the US, because my mom would not let me move out of the country for 2 years. As soon as I got accepted to both AmeriCorps and CTY, UB, the medical school, contacted me that they have an opening and they have a spot for me for medical school. It's actually pretty neat. So when I got that letter, I was like, well, I've committed to doing this work in California and in Chicago, but then this means that I may lose my opportunity to go to medical school. I may have to apply again. And so again, I went to my pre-health advisor and shared with her, like, this is my dilemma, like, what can we do? And we sat down. She actually helped me draft the letter to the medical school, because I didn't know that you can defer. And so we wrote a letter of deferment, and the school actually approved my deferment. So I deferred a year in order for me to do the CTY and my AmeriCorps work. Because after all, I was going to graduate college before I was even 21. And so that helped with like a compelling argument for them. I eventually graduated with honors with 3 separate degrees, and that's a humble brag, but I actually worked a ton for that. I was so lost in thermodynamics that I had to drop the class, which meant that I was not going to get that double major in chemistry after all. But again, I worked hard for these degrees, and at the same time, an acknowledgement that none of these degrees necessarily got me into medical school on their own. And that's there's opportunities here for taking, realizing the opportunities that I encounter and taking advantage of that. I've tried to dug up some CTY pictures of my blue hair days, and this is all I could find. So. Working for AmeriCorps taught me a lot. I was very poor. I shared with 2 other roommates. My room was 8 by 8 feet, and no, it's not feet. Yep, 8 by 8 feet. And so I had to build my bed and actually loft that. Home Depot was so nice to me in Chicago. They let me use their equipment to create stilts to loft the bed. And I didn't know how to do that. So they also taught me how to do that. My coworkers were all on food stamps when we were in AmeriCorps, but I wasn't a U.S. citizen then, and so I did not qualify. And so I worked at a movie theater, AMC, selling popcorn at nights, and I tutored the SATs on weekends. And yes, the irony there is that I was teaching how to study for the SAT when I actually did terrible on the SAT. And what it is that there's actually a formula on what to do. Like there's techniques that you can do to study for standardized tests. And if you're coming from under-resourced background, if you don't have the money to pay for that, then it puts you at a disadvantage because you're not going to get as high of a grade. What I learned then was that SAT is actually not that hard. You just need dedicated training, which if you're poor, again, you're likely not going to be able to afford. But if you can use the other resources out there, like the library or whatever else financial aid you can get, or even just knowing that there's the ways to do better on those tests, like that would have helped me a ton. I also want to acknowledge another important person in this journey. Her name is Dr. Marianne Rokitka. She's an advisor for the Association of Pre-Medical Students. None of you probably know these people that I'm naming, but for me, it's that important that I recognize them. Dr. Rokitka was a constant, solid figure in pre-med and generously volunteered countless of hours to advise students on getting into medical school. I wish I took advantage of that more because I think maybe it was the imposter syndrome in me that I didn't really ask her more about my application to medicine, but more so like just working alongside her with the different events for that group that we were working. But she was really there throughout those times, and I still keep in touch with her. They even sent me a care package when I was in Chicago doing AmeriCorps. And so as an aside, another advice that might be helpful is surround yourself with good people. It really helps weather the challenging path that's the path to medicine is. And so the next stop is, so this is Buffalo, the medical school. So I went to medical school there as well. And I talked to you about starting AmeriCorps first. And when I was in AmeriCorps, I actually, after probably 6 months, I was really feeling burnt out. So my work in AmeriCorps was I worked in the west side of Chicago. My job was to connect patients with no health insurance to primary care. And invariably, these patients would have addiction to substances and or they would work in the streets. And so I had to be creative with looking for them. So I would find them under the bridge or different parts of the neighborhood. And after a while, it got to me. And I went to my boss. I remember this. I went to my boss and I said, "Hey, I'm feeling really burnt out about this. Like, how do you do this every single day? Like, you see suffering every single day." And at that time, I also watched, and probably none of you have seen this movie, Patch Adams. Robin Williams is like one of the Robin Williams plays Patch, and so there's a real Patch Adams, and so. Somehow around the same time that I was mentioning this, I was feeling fried. I saw the movie and I found out that Patch was actually giving a talk at Urbana-Champaign, which is a couple of hours drive from Chicago. And so my boss let me go to meet the real Patch Adams and his work on social justice and just being nice and kind to your colleagues. And so I asked him the question, like, how do you sustain yourself? And I didn't really get a good answer then. But fast forward going to medical school. In my second year or third year of medical school, I was part of the American, it's not it's American Medical Student Association, so AMSA. and they were partnering with Patch Adams. So again, like Patch came back into like an email form or something, and so I applied for it. I got accepted as, I think, one of 30 or one of 40 people that got accepted across the country to be part of the Circle of Healers group. And so we were clowning with Patch. So Patch is a clown who went to medical school, and so I actually spent time at Gesundheit Institute and learned some clowning with Patch. That's how the real Patch Adams look like. And so after medical school, I trained at one of the biggest emergency medicine programs in the country. And yes, I did pursue emergency medicine, even though I got scolded for saying that I picked it because of a TV show. The program that I attended is one of the oldest, one of the busiest, and a lot of like these superlatives. It's in the heart of the Bronx, and we saw our fair share of knife and gun resuscitations at Jacobi. Montefiore is the academic institution, and there we saw a bunch of the high acuity LVADs, ECMO, all these like fancy stuff and diseases that I've never even heard of. And so Google became an instant friend for me then. And during residency, I picked up some new skills. So I picked up scuba diving. That's my dive buddy. This is a picture that I took. That's a white tip shark. That's how big to scale the shark is, heading towards me, because I was like, I saw it, and then instead of freaking out, I guess I grabbed my camera and shot a picture. And then when I was in residency, I love emergency medicine. I can talk about emergency medicine, but when I was there, I also started really enjoying austere environments. So places we don't have a lot of resources. Again, Jacobi is a county hospital. And so I was really attracted to that. In 2010, there was a big earthquake in Haiti. And so I volunteered my time there for a week. I ran the emergency department. I was the most senior. I don't know how that happened, but I was the most senior. I was only a third-year resident. And so I ran that tent, resuscitating and creating like systems to kind of make our work more efficient. You'll see a picture there in the bottom left, like it started pouring rain. And so the bottom right, the emergency department, which is really a tent outside the airport, was flooded. And that's a patient that we had to kind of evacuate to another area because of the condition in that tent. And then shortly after that, a year later, my senior year, before I graduated from my residency training, I went to Ghana, and my goal there was to learn how to run systems improvement in a bigger scale. And similarly, somehow I became like the most senior person there, and so I ran the emergency department. And this is one of the first cases on my first day. A young man was struck by a fallen branch of a mango tree. And so in my mind, I was like, where am I? Mango tree is just falling on you here. And then quickly went back to the patient who's now paralyzed. And so our ambulance in that town was out of commission because they got into an accident prior to the day before. And so we didn't have an ambulance. And so I also knew that this is in the middle of nowhere, and I had to transfer the patient to a higher level of care. And so we brainstormed and we hired like a Jeep, like a tuk-tuk, and took out the chairs in that tuk-tuk. I used the door as the backboard for this patient. And we started like taping him up so that his neck was secured. And this is pretty much like my life there for 2 months. And it goes to show that really learning and training emergency medicine and being good at it allows you to really practice wherever you go. So after 4 years of training, it was time to venture out and take that jump. And there's two main directions that people usually take right after residency. They either go to academics or a community practice, academics being like in a big medical system or a community place, any of the community hospitals. So in as much as this decision point is scary and dizzying, it's also really fun. You'll finally get to decide what you really want to do. And with that, of course, comes with risks, the benefits, and of course, excitement. And I can't emphasize here again, like taking advantage of mentors that you meet along the way, like people that can guide you to like just even talk through things. Because again, as somebody who's like, this is the first time, right? Like I'm the first in my family to be in this situation. Like there's nobody in my family they can ask like, hey, what should I do? Community or academics? Like they probably have never heard of that. And so taking advantage of the resources that you have and asking around is definitely helpful, which means you have to be vulnerable because you have to be okay with like feeling that people may judge you. And you know what, like people who judge you, they're probably not going to be able to help you anyway. And so you might as well just work with people who are able to help you. So what I ended up in going to California, and mostly for bizarre other reasons that it's hard to really explain here, other than the fact that there's a lot more resources in California compared to New York City. And plus, I lived there for a summer. Remember, I did that CTY program, and I really enjoyed my the lifestyle and also the work there. And so I applied. And I ended up in the Santa Clara Valley, which is a county hospital. At that time, it was the busiest hospital in the Bay Area. It was the second busiest in California. And so which really aligned with my goal, which was to focus on my clinical skills at that time, and my special interest in running hospitals and being an administrator. And so I actually became an assistant medical director in this place. And also like I wanted to do more austere environment, like I said, like going abroad. And then I realized I have all these student loans that I took. And so I have to start paying them off. And so for me, the closest thing to that experience was working in county hospitals. And then I realized that I get to work with some really, really smart people. I get to work with medical students. And it reminded me how fun that was. And so they asked me to teach one class and like do some interviews. And next thing you know, I was asked if I'd be interested in applying for this assistant program director job. So the program director for you is it's essentially the admissions committee for emergency medicine in our shop at Stanford. I didn't know actually that Santa Clara Valley was affiliated with Stanford, and so when I got the job, I was like, oh crap, like I can actually work at Stanford, like the same place that I didn't get an interview for medical school, the same place that I didn't get an interview for residency, and here I am now, actually working here and interviewing people to come here. And so I think my point of sharing this is that you don't really just discount yourself by saying like, you know what, I'm not good enough to apply to Stanford. I'm not good enough to apply to Harvard. I would never be that guy that would say like, you know what, I could have gone to Harvard because, you know, I applied and I did not get in. And so I'm very comfortable with saying like, yeah, and I didn't get in because here I am now, right? Like 20 years later, I guess, since that journey started, I'm now part of the admissions committee. I'm now part to like interviewing people for jobs here. And so wherever you come from, I want you to also realize that there are plenty of opportunities ahead of you. And it's a matter of aligning that to your passion and really figuring out what you want to do. And so speaking of which, I think another point that I wanted to bring up is this idea of the work-life balance or work-life integration. Because being California and the land of milk and honey, work-life balance is something that we take very seriously. We respect the fact that emergency medicine has the highest burnout rate in medicine, right? That's a fact. And it's important to keep in mind that as you advance in your career, you have to learn how to take care of yourself. So for me, it's traveling, it's spending time with your family, nurturing meaningful relationships, right? Sleep, exercise, eating healthy. Again, another big topic here, but I just wanted to bring that up. And so this, we're almost done. I'm getting to the final slides that I have here. By the way, this is a good friend of mine. So I talked to you about traveling. I travel all over the country, the world now. Pre-COVID, I traveled twice a year outside the country so that I can expand my horizons and see other worlds. This is in the middle of the desert in a uni in Bolivia. With no immediate access to healthcare. He was so dehydrated from a enteritis. Like he ate something that just made him like puke and have diarrhea everywhere. And and he was so dehydrated that we were at the point of canceling our trip. But somehow I lucked out. I found a clinic where I was able to buy some supplies and actually put in an IV on him, hydrated him, and we were able to finish our trip. And so this highlights this concept of emergency medicine being able to take care of anyone, anytime, anywhere. And you'll be able to make sure that you're making a positive difference in someone's life on every single shift. So now I'm going to put on some advising hat here. As someone who interviews for the School of Medicine at Stanford, and also in emergency medicine residency, and also hire faculty and fellows for Stanford, I can tell you that you're more than just a conglomeration of grades and standardized tests, although they are important, and I just told you, right? Because I struggle with those standardized tests that I shared with you earlier. And so I want you to see that there are other things that is important, and you have to consider that as well. And so another thing to focus on when it comes to tests is deliberate practice. You just have to do a bunch of practice, but very specific in what you're doing with it, instead of just doing a bunch of tests and not really learning from the mistakes that you're making. I didn't know that. In terms of participation and what counts and what doesn't count, I love this barometer that I've seen at MD admissions. You really want to aim towards the bigger circle, which is you want to leave a legacy on whatever that you do. So I'm very excited, and I celebrate the success of this pre-health shadowing group that you're able to create this. But think of ways that you can leave legacy. Like when you graduate, when you become a doctor, like what would pre-health shadowing look like because of you? And so that will be your contribution. Simply showing up is not enough. So again, going back to the initial article that I was referencing, Benjamin Bloom, a professor of education at the University of Chicago, he published this landmark book, Developing Talent in Young People, which examined the critical factors that contribute to talent. He took a deep retrospective look at the childhoods of 120 elite performers who had won international competitions or awards in fields ranging from music and the arts to mathematics and neurology. And surprisingly, Bloom's work found no early indicators that could have predicted the virtuoso success. And so what the article was saying is that subsequent research confirms that there's actually no correlation between IQ and expert performance in fields such as chess, music, sports, and medicine. And so the only innate difference that turns out to be significant, and they matter, primarily in sports, are height and body size. So really only in sports will height and body size matter. Beyond that, in many of these other like fields, it doesn't matter. And so what does matter? So what matters is you have to practice intensively. So you have to do a lot of practice, right? You have to have devoted teachers to actually help you, guide you with the process. And then you have to be supported enthusiastically. So while my mom didn't really like support me going to medicine, it was not that, so when we teased it out, it was not that she doesn't want me to be a doctor, she just couldn't afford it. And so then I had to figure out ways of funding that. And that's how I was able to get the support. I have to throw in self-compassion here because I really believe that you need self-compassion in order to become successful. We got here, or I got here because there are times that I would sacrifice like not sleeping or not eating because maybe if I just study 2 more hours, I'll do better in this test. You have to learn how to create boundaries in order for you to take care of yourself as well. Because if you're not rested, you're not going to do well. And that goes definitely for me in my work. Here's a nice quote. The source of everything respectable in man, either as an intellectual or as a moral being, is that his errors are corrigible. He is capable of rectifying his mistakes by discussion and experience. So you need people to give you that feedback, not by experience alone. And there must be discussion to show how experience is to be interpreted. Again, you need guides to do that. And here's another quote that I really like. It's on deliberate practice. So here we have deliberate practice in a nutshell. Get outside your comfort zone, but do it in a focused way. And you can plug and play here. It could be like studying for your SAT or SAT for the high school students there, or the Mcats. You have to have clear goals and a plan for reaching those goals. So maybe the plan is like, I need to actually learn how to study for tests because I'm terrible at it, right? And then a way to monitor your progress. You got to do multiple tests, monitor your progress. Are you actually getting better? Instead of just showing up and taking the test, which I have done, which I do not recommend. Oh, and figure out a way to maintain your motivation. And that is really learning how to take care of yourself. And so in summary, this is how I maintain my motivation. I eat a lot, I travel a lot, and I've gone to so many different fun places across the globe. And I'm surrounded by people that I really, truly care about. So emergency medicine is a humbling profession. It's fun, it's a lot of work, and you will make a difference every single day, right? So I wish each and every one of you the best in your career choices. Remember that each one of us was given a lot in life, some more, some less than others. And however, right this very moment, at this very, very moment, we are having a conversation about journeying in medicine. What got you this far is your story alone. Own that, embrace that, seek mentorship, do your part, be grateful, and most of all, be kind to others. You never know who you'll meet along the way, right? Again, I'm happy to answer any questions, and feel free to either follow me or send me messages on Twitter, because I respond to that a lot faster than I would respond to my emails. All right, thank you.
Thank you so much for your presentation. It was really inspiring, and thank you for being vulnerable with us. I'm sure everybody really appreciated that. I know that I did. So we'll go straight into the Q&A now. You talked a lot about your experiences throughout college, and it seems like you were a busy bee. And so a student is asking, how did you manage a job, schoolwork, and just, all of your classes?
Yeah, really sitting down and writing down your calendar. So I still do it. Like I can show you my notes for today, which is, you can't read this, but essentially I still write down like what I need to do. I prioritize what is really important that needs to be done like today, tomorrow. I work with deadlines. I think if you don't remember, I probably have said that when somebody invited me to give this talk. Give me a deadline, give me when you need things to buy, because if you don't give me a deadline, I will not do it. If it's not in my calendar, I will not do it. So that's the next thing that I do now. Like, can you please just put it in the calendar? So send me a calendar invite. So back then I didn't have that. I didn't have that technology. But what really was important for me then, and probably I would not have gone through all three majors, like all 3 degrees again, if I knew. But again, I did it because I was just passionate about the things that I liked then. Was to make sure that I calendar taking care of myself as well. So now I really do. I have vacations scheduled, and I put that in my calendar. So if I'm going to have dinner with my friends, I put that in my calendar, because I don't want my calendar to just be full of the tasks that I need to do. And there's a great lecturer at Stanford, Jennifer Kanapicki, Dr. Jennifer Kanapicki, and she talks about how writing to-do lists actually do not work, because we're rarely able to finish our to-do list. And what's better is we actually put in the calendar. So calendaring your to-do list. So if I need to do, I don't know, grocery, I'll put that in my calendar. So then I know I block that time to do groceries, and then it's sacred. Like if you want to call me for a meeting and I'm supposed to go to the grocery, I will say, I'm sorry, I'm busy, I have an appointment. Nobody needs to know like what that appointment is, but I have an appointment, which is I need to go grocery shop, or I need to take a nap, or I need to go to whatever I need to do, right? So that's one way of protecting your time.
Thank you
I'm
so much.
overwhelmed with the messages, by the way, in the chat, and so I'm not going to be able to read all of that. But thank you, and so just send me, or I'll answer questions more.
Thank you so much. So our next question is, how would you advise preparing for interviews?
How would I advise preparing for interviews? So several things. You need to be able to practice, right? So which means that you're amongst yourselves here, you can practice amongst each other. The fact that you're able to just talk about difficult things, challenging things about yourself, is going to set you apart from other people who may not have that experience. Trust me, I have seen, so again, I've interviewed at the School of Medicine, and some people I know that they're like well rehearsed. They have like tutors to like help them interview. And then of course, there's some people who've never had that because of their financial background, right? But you know what's most important? being able to be vulnerable, being able to share something about yourself that is not rehearsed, that's not written, just like from your heart. And 100%, those candidates do a lot better in my mind, because it's your story. Nobody else can take that away from you. Nobody can coach you about that. Really being able to share your own journey is helpful.
Thank you. Our next question is, how did you fight the economic burden of medical school?
Oh, yeah, I took out loans, period. Right? Like some people say like, oh, don't take out loans, you're gonna be broke. Like, yeah, but I don't know any doctors who's starving. Right. And so I made that decision. And partly that was because of my work in AmeriCorps. I knew how it was to starve, and I knew how it was to like make like really, really like small paycheck meet for a week. And so when I was in medical school, I'm like, I'm not gonna do this, right? Like I will max out my loans, right? I had extra because then I was able to travel. I was able to like actually enjoy my vacation, because you know what? I won't be able to buy that time in medical school, right? Struggling in medical school is one thing because of the rigor. Like it's hard, right? Medical school is not supposed to be easy. And then adding like the financial burden of like not being able to eat when you need to, like that is a problem. And so talk to the financial advisors, right? Talk to your mentor. Like they'll be able to help you. They'll connect you with resources. And for me, I took out loans. I'm still paying for it. That's why I'm not traveling. I can't do like those international work that I used to do in residency, because now I have to pay off my loans, but it's still totally worth it.
Nice to know that we can relate. So our next question is, what was COVID like in the ER?
Yeah, COVID is tough in the emergency department. I actually, when COVID was just hitting New York City, I was there only because I shared with you that I make it a point to still thank the people that have helped me along the way. And so I went back to Jacoby. One of my favorite attendings, my mentor, was working a shift, and I actually visited her in the emergency department, and I saw how limited the resources that they had there. I'm privileged to work at a place like Stanford. I'm very grateful for that, because we have a ton of resources here, and I know that many other places around the country do not have that. But the volume is there in terms of there's a lot of sick people, and you know what? At the end of the day, um, just like me, my patients are also human beings who are suffering, who are nervous. And so I remind myself that when I forget, because I'm covered with all of these PPEs. And so I take a point to like, sometimes like you need to hold people's hands, even though you're not supposed to, right? Just double glove or something like that. Back in the day when we didn't know how it's transmitted, like that's what you need to be able to do in order to also take care of yourself. Like I would do that, because it's not just for the patient, it's actually for me, being able to connect to people. Because I think that's why we all want to pursue a career in the healthcare field, right? To be able to help people. And it's not always solving problems. It's not always like fixing the problems and curing the disease. All right. So there's no quick solution when you get COVID. You're gonna be sick and it's gonna suck. It's gonna like you're gonna be miserable. But you can normalize that for them. You can talk to them. You can listen to them. You can listen to how scared they are. And that I think is very powerful. No amount of prescription I can offer that will take that from the patient.
Thank you. You touched on this question a little bit already, but how were you able to get all of these opportunities that you talked about during your residency?
Yeah, random. I talk a lot about what I want to do, and so I think that's something that's I've learned. I didn't know that there was a term about it, vulnerability, which is I share with people like, hey, I really want to do this, or I'm really struggling with this, and you'll be surprised how many people are willing to help you. Like when I was an intern, I remember this. I've never really traveled outside the country on my own that was not organized. So in medical school, I organized this trip to go to Spain to learn medical Spanish because, quite frankly, I know this is recorded, I didn't want to do research. I hated research. And so, but you have to do something between the first and second year of medical school because that's what you need to do to apply for a residency. And so, you know what I did? Remember that circle? Like you can either show up or you can be a leader and like the legacy part. So I organized a trip to go to Spain for several of my classmates. So I organized a group of 6 people to learn medical Spanish in Spain, because why not go to Spain? You can go anywhere else, right? And I didn't just show up, I organized. So I was a leader. And so I was able to highlight that in my application. So like, again, you have to be creative. And so my point of sharing that was that I did that, but it was part of a group. It was like organized. And but my intern year, I said, I really love traveling because of that. I bought a ticket to Guatemala, and I didn't know anybody in Guatemala. I didn't know what to do. I literally like had no plans of what to do there. And so I told everybody in my class, in my residency class, I'm like, hey, I'm going to Guatemala. Have you guys been there? And somehow one of my classmates, his grandmother owns like a hotel there, which is actually like an iconic hotel. It's the Cloisters. And so I got to stay at the Cloisters for $10 a day, because I'm related, or I'm friends with the grandson of the owner. So like things like that. I think for me, part of it is called being lucky. I call it travel magic. I think it's just how you portray yourself outward to other people. Like, maybe people feel bad for me all the time, that people feel the need to like help me, but really it's just, this is how I talk, right? How I'm talking to you now, this is how I am like at work. My patients see me like this. And it's fairly open book. And I think people find that if I need something, that people help. Versus in the past, I would, especially like dealing with imposter syndrome, I would be so scared to like ask for help, because I worried like maybe they'll judge me, maybe I won't even get in because I'll jinx myself. And none of that works, right? Like it's not, there's no science behind that. Not that there's science with what I'm saying, but I'd rather be on the positive side than be constantly like worried about like the negative ramification of thinking if I share something about me, something would happen. I don't know if that's making sense.
It makes total sense. I love how transparent you are with us. I really appreciate it. So our next question is, could you tell us more about working in the ER, like your day-to-day life?
Yeah. By the way, I'm gonna give you a tip here. I'm not a purist, but there are other people. Emergency medicine is a new field relatively compared to other fields in medicine. It's less than 100 years. It's just a little over 50 years. And so if you say ER, that's very colloquial, like non-medicine people. But if you say that to emergency physicians, some of them will growl, because it's not just a room, it's an entire department now, because we fought for this department to exist. But anyway, I lost my train of thought. What was the question again? Something about the ED?
What was your day-to-day like?
My day, I work tonight. So I'm a nocturnist. I only work overnights. And so I work tonight at 11 o'clock to 7. And my day-to-day is I show up to work. And I work with stellar residents who are going to be, I think I work with one resident tonight because I'm on another zone. But in any case, you see everybody. I don't know who's coming, right? There's no appointments to go to the emergency department. I don't know what kind of resuscitations we do. I don't know what kind of things that we were going to be seeing, what procedures we're going to be doing. But I know one thing. See, there's things that there's so many things I have no control. There's a very few things that I have control, and I treasure all of that, which is tonight I'm going to bring food because I love food, and I always bring food when I work because it makes people happy, right? It connects people, especially in an era where everybody is like PPE and like covered up, right? I bring snacks because then, especially if it's snacks that people have never tried before, it's like, ooh, what is this? And then people like chit chat and talk. It brings people together. So yeah, so I don't know what's going to happen tonight, but a typical day for me, every single shift that I do, at least like since I've started at Stanford, is I bring food, snacks. And sometimes, especially if I do it because I do a string of shifts, like usually 3 or 4 nights in a row. Once after tonight, I'm going to ask whoever I'm working with, because I work with them then for the next couple of nights, what their favorite food is. And then it gives me some joy. Like the next day I go to grocery shopping. It gives me another thing to do on the way home, to stop by, ooh, what are we going to eat tonight? So something to look forward to. I always try to have something to look forward to, I think.
Thank you. I definitely can relate looking forward to food.
Yeah. And wherever you go, right? So wherever you go, especially when it's high tense, high stress environment, bring food. You can never fail with food, right? And if they're grumpy and they're not going to eat food, who cares? At least you get something to eat.
Definitely. That is great advice for the future. You talked a lot about your travels, and how do you believe that your international medical experience has shaped your education?
Oh yeah, so I wish I traveled a lot more before. I traveled, but I wouldn't have been able to afford it. The reason I travel, actually, full disclosure, I know this is recorded. I moved from the Philippines to the U.S., and so I missed geography in high school, and so I never actually learned like the different countries in the world. And then I was so worried that I'm gonna fail that in college because that was one of the requirements to graduate. And so I never took it until like senior year in college. And so by that time, like, I'm also human, just like you. And so senioritis kicked in. I don't remember like studying anything for that class, like the history stuff. And so I literally traveled to get to know the different countries where things are. If you ask me why Italy looked like a boot, like, I don't know, 15 years ago, I would not have any clue. I don't know what you're talking about. Now I know because I've been to like different parts of that boot. And so how it's shaped me, I think it's this conversation. It's a lot of transaction, right? Like when I talk to patients, when I talk to my mentees, I got to get to know like what drives them, what is exciting for them, in order for me to also share my knowledge. I can't just like give you a lecture about something and not understand where you're coming from. So I think for me, that's really one of the best things that I've gotten from traveling, because English is not my first language. And so figuring out like ways to communicate that really makes the other person understand me, I think is helpful. And so, yeah, I think that for me is helpful a lot. And also the food, it's great wherever you travel.
That is very true. It's wonderful everywhere. So, what do you recommend for students who are trying to prepare for the MCATs and gain experience during this pandemic?
Yeah. Understand that there are ways to study for the MCAT. Understand that there are ways to study for these standardized tests. And you can't just like wing it, even though you're like a straight A student at your school, because there's a different way of answering those. I think that's one. So it requires a ton of practice. And then, honestly, be kind to yourself, right? Some of you, or many of you, or definitely me, right? I don't know about you, maybe you're all geniuses here, but like me, I did not like get a great grade, right? And so I was so hard on myself, right? And then I realized like, why? It doesn't, no grade should define somebody, right? It should not define you in becoming a doctor. So if you did terrible, right? Then study, figure out why you did terrible. Is it because you're so distracted? You had so many things going on? That's very common. We make getting into medical school so hard now that like you feel that you want to like, you got to do volunteer work and also lead something and leave a legacy and like pass the MCAT, do well, not just pass, do very well in MCAT and then ace all your grade. Like you got to take organic chemistry, all these crap. At the end of the day, you have to remind yourself that, hey, I really want to be a doctor because I want to do X, Y, Z. And you constantly remind yourself that. And if that's your best, then you do something better on another area that you're actually better at. Right. So I that was not easy for me to really learn, but now knowing what I know now, being kind to yourself is definitely very important. And only when you're kinder to yourself, self-compassion, are you able to actually see beyond beating yourself up that you're not good enough. Then you're gonna say like, okay, well, I totally screwed that up because I had so many commitments. So now I'm I'm gonna block off like 3 weeks or a month or 2 months, and I will have a calendar. This is what I'm gonna do every single day. And so that is deliberate practice, as opposed to just like hoping for the best and not really having like a plan for it. So that's my suggestion. I briefly saw, I love all these like questions that come up. I saw something about blue hair. I would not dye your hair blue hair when you interview. It's totally not a good idea. Just gives them another point to like ask you that it's not really relevant to your goal, which is becoming a doctor.
Definitely.
You
Thank
do it
you.
afterwards.
A quick question, just in your opinion, does it matter what undergraduate university you go to before applying to medical school?
I don't think so. And in fact, several big institutions like Stanford look at students who start off at community colleges and then transfer to a big university, because what we're looking for is really, and I don't speak on behalf of Stanford, I'm just speaking on behalf of what I've seen over the years, is the idea of the distance traveled, right? And like I said in that slide, each of us have been given a lot in life, and that distance of how we got here today, that is your story, and how you share that story, and how you make the other person realize that you are also just like the interviewer. You also want the same things, like being a doctor, being able to help people, like whatever reasons you have. That's your story. Nobody can take that away from you, and I think that's the most important part. So again, I gave you my example, which is I didn't go to like a stellar, I mean, I think UB is great, but like it is a state school, right? It's not an Ivy League school. I applied to all these like amazing Ivy League programs. I did not get an interview, zero, like not even one, right? But it doesn't matter, because and I tell people this when I interview them now, when they're so nervous about, especially the people that I'm advising, like they're so worried, like, oh, I really want to go to Stanford. Like that should not define you as well, right? Because I ended up here because I really like what I do, and so you should go wherever you feel that you're going to be supported and that you can actually thrive and do so well. Like if I ended up in a nice like Ivy League in undergrad, I probably would not be able to do all the cool things that I got to do because I would be so worried about competing with everybody else. And so create that path for yourself. And I know that's not easily done, it's easily said, but that's where mentors, advisors, coaches are really, really helpful.
Thank you. So we are getting this question repeated. So do you have any advice for high schoolers?
Do I have any advice to any high schoolers? Yeah, enjoy your vacation, enjoy all the free time that you have, and focus on a passion. Truly, like I people who know me know this. I use this a lot. If you love underwater basket weaving, totally do underwater basket weaving and write something about, present something about, invent something related to underwater basket weaving. Because when we interview you, right, when we read your application, we want to see that you've actually done something with your passion, right? So it's one thing if you just like it as a hobby, that's great. Like you should continue your hobby. But if you really, really love something, then you got to spend some time there, right? You have the luxury of time right now. And also I would suggest traveling if you can. However it is, like maybe doing some volunteer work somewhere. That way you don't have to pay for it, right? There are plenty of opportunities out there, and guidance counselors can help with this. And also for those high school students who have had guidance counselors tell them like, oh, you shouldn't go to this program because you're not smart enough or you're not good enough or whatever. Yeah, you say, yeah, thank you. And then you apply, right? Because you know what? It doesn't matter, right? It's totally worth, just apply. You'll be very surprised like what comes your way. At least that's what I've done.
Definitely. You talked about applying to, lots of different medical schools. How did you not lose hope when applying to so many?
Oh gosh, yeah, that was an awful time of my life, because getting those rejection letters are not fun, and that's why I'm like a broken record here. You need people that you can confide to and share that and say like, listen, like, what does this mean? Like, does this mean that I'm not really good enough? Like, what can I do better? Having I think friends who have gone through it. So one of my good friends who was a year ahead of me. So my floor mates in the dorms, she helped me, and she's super smart. She ended up at Harvard Medical School, but she was the one that would like knock on my door, like, hey, we got to go to biochemistry, or hey, let's do some studying. And so I think surrounding yourself with gritty people, surrounding yourself with like people who do well, but not there to compete with you, just really like see you as a friend, and really cherish those like friends that you have.
Thank you so much. So we do have one last question for you.
Sure.
And it is how and where you got your mentors from. And then afterwards, do you have any last minute advice for us?
Yeah. So how do I get my mentors? they clearly did not define, like they did not have logo that they are going to be my mentors. It's who you jive with. It may be your boss. It may be like the secretary in the work that you're doing. So for some of you who are scribing, for instance, like you'll meet some different physicians or some students, right, who are ahead of you. I think it's also a misconception that you only need one mentor. I have a ton of mentors. I need a mentor for like my traveling. I need a mentor for like applying to medical school. I needed a mentor for my personal statement, like somebody to just guide me with my personal statement, that kind of stuff. And don't underestimate the power of social media. Like I gave you my social media, for instance, on Twitter, and I know many of you probably do not use Twitter anymore, but that's okay. But in medical fields, the people are actually still very active on Twitter. And so for me, still now, like if there's an author that I really want to meet, I send them a message on social media, and people are fairly responsive, rather than sending them an email. I find that leveraging the power of social media is actually very, very powerful for me. My advice, there's so many. I hope you learned something from me today. I think my advice is that you have to get to know yourself and understand your passions. And that is not easy, because sometimes our passions are driven by our parents, what we've seen on TV, what we were told to do. But sometimes, somewhere along the way, you gotta like pause and recognize that, why am I really doing this? And if you can honestly tell yourself, and you can envision yourself like, you know what, I'm going to be a doctor, I'm going to be a nurse, I'm going to be a physician assistant, and understand your why. If you can articulate that why, the rest is going to be easy, because that's how you break down all of these like challenges that you're going to reach, right? I shared with you that a good friend of mine that was my bouncing board when I was struggling with getting my acceptance to medical school. And she reminded me, she's like, it doesn't end here. You think that you're going to get into medical school and life is going to be easy. It's not. There are always going to be ways that people will ask you, do you really want to be a doctor? And so they give you another test, and then you do well on that, or you barely pass it, but you pass. And then you do another test, and there's constantly several ways of people questioning, like, do you really want to continue, or do you want to quit now? And so what is most important for me is understanding my why and really reminding myself of that why. And it's also important to know that the path on becoming a doctor or the PA or whatever you want to be should not define you. There's other things about you that really is important. And I think that's something that you should hold on to as well, right? So when I got those rejection letters, they sucked. They were painful. And at the same time, it doesn't mean that I'm not going to be a doctor, right? At that point, it felt like it. But here I am now, like giving you that talk. And so just imagine yourself like 10 years, 20 years down the road, giving yourself that talk, right? And be kind to yourself. I think that's, if there's one thing that I can leave you, it's that notion of being kind to yourself, because that's not easy.
Thank you so much, Dr. Alvarez. That was an amazing presentation, and we are so honored to host you. For all of my students, listen up. We have some important information regarding the post-shadowing assessment to get your certificate that verifies your virtual shadowing hours today.
Holy crap, you get like a certificate for listening to me. How cool is that?
Yes. And so for the certificate, you do need a 70% or higher to pass. We do have a lot of students joining us today, so I recommend, if you are able to, space out your times that you're taking the post-shadowing assessment. If we do have too many students on it at once, we risk crashing the website. So we really recommend that you guys help us fundraise. We do have a lot of opportunities for fundraising coming up. So just really try to help us out where you can. A lot of it benefits you guys as well. So you guys can get free Kaplan materials. You guys can get seats at a women's summit. You guys can buy masks. And so we are trying to provide things that you guys will benefit from and also help us in the process. So Guys, this is a wonderful opportunity that we get to spend with Dr. Alvarez. Be sure to reflect on all of the amazing things that you heard today. You know, why did you join us? You know, what brought you here today? And, you know, what part of the session really resonated you? Is there anything that you're going to take away? Can you find 3 key takeaways from today's session that you're going to implement into your life? And so definitely, you don't have to turn these in to prove that you were, you know, here with us at our virtual shadowing session. But if you are interested in getting published, you can do so on our website. We do have a submission, so you guys can submit any reflections. You can submit a reflection that you had from today's session, and it will go to our editor-in-chief, who will give you back some insightful feedback before it goes up onto our official website. So if you guys are interested, definitely take advantage of that. You can put it on your, you know, your applications, your LinkedIn. It's something that you can be proud of when it's out there and say, put your face on something. So if you guys are interested, we are taking applications to join our student team. These are leadership roles within pre-health shadowing that are 100% remote, gives you the opportunity to meet with like-minded students and, you know, reach out to professionals, make those useful connections that you're going to want for the future. You can gain some professional experience. You can also help yourself academically and personally, as well as make some new friends. And so if you're interested in applying, you can do so on our website under the contact tab in the main menu. You can also scan this QR code that we have here. But of course, we are all pre-health students and time is of the essence. We may not have too much of it, especially that we are in classes right now. So if you guys want to get involved but do not have the time, that's okay. You can actually make your own schedule. We have asynchronous volunteer opportunities that you can do on your own time, on your own schedule. So if the only time you have is at 2 o'clock in the morning, we are more than happy to have you help us out at 2 a.m. Some tasks that you can do are professional nominations, so finding the information of interesting professionals that you would like to hear from. And another thing is student outreach. So you guys can actually reach out to different universities around the world to tell them about pre-health shadowing. So if you are interested, we also have hands-on virtual opportunities for volunteering, where you can involve yourself in different fields such as design, marketing, PR, grant writing, and grant searching, all of these different things. So if you guys are interested, do check it out. You can volunteer. High schoolers can volunteer, anyone. It's open to anybody, anywhere in the world. So if you guys are interested, go to our website. We do have a volunteer connection day this Sunday. If you are a volunteer, we hope to see you there. It's the opportunity to check out and meet the other volunteers. You can kind of learn, meet each other. We're all coming from different parts of the world, so it's a wonderful time to kind of just network. We will have prizes at this volunteer networking event, and so if you are interested, be sure to sign on in. We will be posting more information on our social media, so be sure to be following us on Instagram at pre-health shadowing. Like I said in the beginning, if you are looking for a mentor, we do have a mentorship networking weekend coming up the weekend of February 21st. So if you are interested, it's a 3-day event, Friday, Saturday, and Sunday. You have the opportunity to meet with up to 6 established professionals and potentially gain a mentor for life. To gain an invitation to this mentorship networking event, you're going to want to download the materials from our Google Drive, register as a volunteer, post it on your social media. Once it's filled, you just turn it in, and then you'll get your RSVP link. So definitely check it out. It's accessible. Anybody can do this. It's open to anybody who is interested. So definitely take advantage of this opportunity. Like I said, be sure to tag us at pre-health shadowing and use the hashtag pre-health shadowing whenever you do anything cool. We'd love to see it. You can get reposted on our official pre-health shadowing account. We are active on all of these platforms. All right, this is a different QR code than I initially brought up. This is actually a link to join our fundraising team. So I ask everybody that is in this chat today to please join our fundraising team. You don't have to contribute any money, but we just ask that if everybody in this room watching me right now can send this out to 5 people, we could potentially raise enough money to keep our website up and open to everybody. So thank you for joining us all. Please help us by keeping us alive. We are a student-led, student-based, nonprofit organization working to create accessible opportunities. We are working to fight against inequity in health education and promote diversity in the various fields. We do have upcoming shadowing sessions next week. We have 3. Be sure to register on our website, prehealthshadowing.com/sessions. And last but not least, to get your certificate that verifies your virtual shadowing hours, you are going to go to our website and find Dr. Alvarez's course. Once you do that, you're going to click free, take this course, and it will take you to the module. You will have 30 minutes to complete the assessment. Once you do that, you can download your certificate. You're going to want to click finish course after you pass. If you do not click finish course, you will not receive your certificate. This is a crucial step. Be sure to do so. If you guys have any questions or experience any technical difficulties, feel free to email us at info@prehealthshadowing.com. And like I said, if you are able to space it out, I recommend doing so. We will be posting this video within 48 hours of the session end time. Thank you all for joining me. Have a wonderful rest of your day. And thank you, Dr. Alvarez. It was a pleasure.
Bye.